Dr. Matthew Weiner from West Bloomfield, Michigan. I'm the author of A Pound to Cure. I'm a weight loss surgeon as well as a nutritional expert, and I'm here to talk to you today about hair loss after bariatric surgery. This is a very common concern amongst my preoperative patients and my postoperative patients because it is a very real issue. And I'm here to kind of give you some more information about it, give you a little bit of something that you can do to help prevent it, but most importantly get you to understand what's going on here. So the first thing that we find is that hair loss varies by procedure. So the gastric bypass procedure, which causes the most weight loss at the fastest rate, we see the most hair loss. With a sleeve gastrectomy, we'll see some, but it tends to be fairly mild. And with gastric banding, we see almost no hair loss, but we also don't see a lot of weight loss as well. And so for that reason, I think it's really not a commonly performed procedure and can probably be ignored for the rest of the talk. But what we really see is hair loss with the gastric bypass and the sleeve gastrectomy. And the first thing that it's important to recognize is that this hair loss is almost always temporary. We start to see the first signs of it around 3 months after the surgery. And then it hits its max around 6 months, but by 9 months we're starting to see the hair come back in, and within about 18 months to 2 years the hair is probably back to around 95% or more of what it was before. Women, for some reason, seem to be more susceptible than men. I'm not sure if this is because women pay more attention to their hair than men or any other factors, but in my practice, for certain, I'm seeing this as more of a problem amongst my female patients. But again, it's important to recognize this is a temporary thing, and it's also heavily dependent on the amount of hair that you have. So if you have a lot of hair to begin with, the amount of hair you lose typically is not going to be all that noticeable. You'll notice it when you're brushing your hair in the shower, but you're not going to necessarily feel like it's a major cosmetic issue. However, if you start with relatively thin hair, that's when we can see patients with really substantial hair loss. Why this happens, we don't fully understand it. I think that nutrition is probably a significant issue, and it may be the rapid weight loss, it may be some nutritional deficiencies. We don't really know exactly what it is, but some things that we do know is that an iron deficiency can absolutely cause some hair loss. In fact, when I see hair loss after a year or more after surgery, I pretty much know that that patient has an iron deficiency. And because we see so much iron deficiency after gastric bypass, somewhere around 10–15% of patients will have significant iron deficiency, not requiring transfusions or any infusions of iron, but requiring supplementation, that because of this, we can certainly attribute some of the hair loss to the iron deficiency. Less common is zinc deficiency, but in patients who are really struggling with hair loss beyond the usual amount that we'd expect, I'll certainly send them for a zinc level. And then also protein, particularly in those first 3 months. I think that a lot of the damage is done in those first 3 months, and then we don't start to see the hair loss until around 3 or more months afterward. But it's important to maintain the protein intake as best we can in those first 3 months. Those of you who've watched my other videos will say, well, I thought you said protein's not all that important. And in the long run, I do not want patients focusing on eating a lot of protein. But in those first 3 months, I think it's critical. Those are the months where I actually do use the protein shakes. And those are the months where I do encourage the protein first nutritional approach. After 3 months, after patients are able to tolerate a reasonable diet, that's when we push the vegetables first model that should carry you out through the rest of your life. So in terms of things you can do to prevent hair loss, what I recommend to my patients is biotin. It's a B vitamin, and you take it, I prescribe it at a very high dose, 10,000 micrograms. This is sold sometimes in 1,000 and 2,000 microgram pills, so you got to make sure you find either the 5,000 or 10,000 microgram pills and take it. Sometimes it's dosed in milligrams. 1,000 micrograms is a milligram, so 10,000 micrograms is 10 milligrams. Also, after surgery, the first 3 months, do everything you possibly can to get adequate protein intake. We stress 50 grams per day for women, 60 grams for men, and I think that's critically important to try to get that within a few days after surgery and try to maintain that for the entire first few months to prevent some of this hair loss. And also, one thing I strongly discourage my patients to do is to blindly supplement zinc. The problem with taking a lot of zinc is that it may inhibit iron absorption. And you may be trying to improve your hair loss by giving yourself big doses of zinc, thinking that's what the cause is, but what's more likely that iron deficiency is an issue, and you may actually trigger or worsen an iron deficiency by taking large doses of zinc. So this, for me, zinc is a supplement that we use only when we document a deficiency. So in summary, hair loss after weight loss surgery is almost always temporary. I would say at least 99% of patients will regrow back most of the hair that they've lost. And it can be caused by nutritional deficiencies, but often it's not. Often this is just something that happens with the weight loss, a part of the surgery. It's an unfortunate part of the surgery, but when we look at the long-term product, for most people this is going to be an acceptable side effect for them to experience for the first year or so after surgery. And then finally, biotin, as well as aggressive protein supplementation in the first 3 months and careful monitoring of your iron level can be very helpful in order to minimize your hair loss. Thank you very much.